in particular the Spanish-speaking population in the U.S. is growing. It is extremely important that we have providers that are competent both linguistically and culturally to work with Latino populations. And one point I often mention is that there are Spanish-speaking people in every corner of the United States. And so if you think this is something that you don't need because you're going to Iowa or someplace where you think there's no one who speaks Spanish, you're wrong. When I worked in northern Wisconsin, we had a large group of Spanish-speaking patients, immigrants from Mexico, and there were no providers who spoke Spanish. So it's really an issue that is affecting all of us, not just say providers in certain states and certain border areas. It's really all of us that need to be prepared for this. Our providers have learned Spanish in other ways, either through college or just through picking it up, working with our patients. And there's varying levels of Spanish proficiency amongst our providers. But one thing I think is really helpful is not all of our providers are completely proficient, but many of our providers, they make an effort to know some Spanish. And so what I tell my students is that even if you can just say, "Hello, my name is," that in the patient's language, I think that really helps put patients at ease. Even if you know a few words, and then you turn it over to your interpreter to help you out, I think just setting that tone really helps patients feel at ease. So, for instance, there's one provider, she actually knows quite a bit of Spanish, and she'll use an interpreter, but she also will use what Spanish she knows. And I think patients really appreciate that.